The way I look at it, I've been in oncology for 21 years, and the field is unlike anything that any of us dreamed of. It's completely transformed in a lot of good ways and in a lot of not so good ways. And our dream would be that eventually cancer will be cured. Some cancers will be cured, some cancers probably will be turned into chronic conditions like diabetes, hypertension. What would be even better is if some cancers don't happen at all. So there's a lot going on there. And I don't think there's any other field that has transformed as much in the last decade as much as oncology. Honestly, every year the number of new drugs that are approved, the new biologics that are approved is almost hard to keep up with, which is great. But then the question is, even a rich country like the United States, can it afford to continue to keep growing at the pace at which it's growing? And can we have patients access all these wonderful gains in treatments? So these are the best and the worst of times. It is just a very tragic coincidence of two things coming together at the same time. I'll focus on the positive first, and then I'll come back to the worst of times. It's amazing that more and more patients get detected early. The treatments are being narrowed down where we escalate when needed and we de-escalate when needed, because it's not just important to cure cancers, but the cancers that are curable, you want to leave patients with less long-term side effects. So we really have to peel the layers of the onion and make sure that the ones that you're curing, that they lead full, complete lives, not burdened by their treatments. So you cure them of the cancer, you don't want them to be handicapped from the treatment. So there is that portion. The cancers that were at high risk for behaving badly, now we have newer treatments, and we are heading towards cure in those cancers too. So we talked about the de-escalation part, where the curable cancers we de-escalate. And you can only do this escalation, de-escalation based on clinical trials. You just can't cook this up and say, I think. You have to prove. You need data. For that, you need clinical trials. For clinical trials, you need a lot of money. And money is becoming scarce, even for a rich country. So there has to be a discussion of what's important to us as a society. And it's a bigger question than what somebody like me can answer. But there needs to be a dialogue between all the parties involved and what's important for us. And where are our values? It's easy to throw that word value around like it's nothing, but it actually takes a lot of time to crystallize the thought on where's our value. And all these wonderful treatments, it's great. They're coming down the pike. Majority, of course, the largest insurer is Medicare in the world, buying healthcare products. So Medicare at least can negotiate to a point as a big payer and control costs, but there is all the other private care that is bearing a lot of burden because they're paying higher bills than Medicare. So the question is, how do employers control costs? Because that's where a lot of patients are, coverage from an employer. So employers are seeing their healthcare costs rise, so they look at their bottom line, and a lot of this is being palmed off on the patient. And you have a patient that is here, overwhelmed with their diagnosis, wondering will they be able to continue to work, and at the same time with high copays, high deductibles, and so it's a perfect storm. And I think it's actually gaining momentum, unbelievable momentum. So, and to be honest, I did not realize this. You'll be surprised at how many doctors don't know what things cost, don't know what COBRA payments are, don't know what balance billing is. for a good reason, right? You're supposed to spend your time paying attention to what's coming new, what you should be doing, the science of oncology. But it is really important to know what the patients are bearing, the burdens they're bearing, or at least have your practice set up. So if you personally can't do it, then the practice needs to help the patients. So that is a field that is rapidly growing on how to help the patient. And the way I look at it, the key word I want to take away from this interview is transparency. That is the word that I will keep repeating. What is opaque is opaque. You don't know what you don't know. And when negotiations of costs and coverage are all opaque, there can be very high margins. So people can tell whatever, we're losing money on X, Y, or Z. But if it's not transparent, we don't know what's going on. So there are, between the manufacturer and the doctors and the patients, there is all these places in between where it's literally like a gas pipeline that you have bandits just coming in and siphoning it off. And I'm sorry to call them bandits, but it's opaque. I don't have a problem if they're legitimate partners in this oncology field. Let's talk. We're in this together. Let's talk. What's reasonable and what's above and beyond sustainable? That's where I'm at with patients. And honestly, patients, when they're in the disease process, they're really burdened. Their families are burdened. And that is maybe not the right time to talk about it. So there you support them. But once they're beyond, it's incredible how generous patients are. If it wasn't for the patients, we wouldn't have clinical trials. You can design the best clinical trials, you can throw a ton of money at it. But if the patients aren't generous, and really, it's beyond generous, they are incredible. Patients actually say, if it doesn't help me, because it really may not help them in the short term, but down the road, it helps other people, I will do it. This is altruism beyond. Is everybody else in that pipeline that altruistic? And that's what I think as a society we need to decide, what are we doing? Maybe we'll be happier if a little bit of altruism, not a ton, not like the patient, maybe just a little bit. So what is that balance of what's sustaining my own industry and what's a little bit of altruism, not lip service, genuine altruism, and say, yeah, maybe I can make the 60% margin, or maybe I shouldn't, because, and everybody on that, including me, has to decide what is acceptable. Otherwise, this field's not moving forward.